I'm really bad about giving awareness to certain topics each month, and so I want to turn 2023 around and start doing awareness month videos, at least for topics that are relevant to my content. So January is birth defect prevention month. In regards to January being birth defect prevention awareness month, and February being CHD or congenital heart awareness month, or also known as heart month, with Valentine's Day, I wanted to talk about single ventricle and what a single ventricle anatomy is, because Noah, for instance, has a single ventricle heart, and he was born with over 7 different heart defects, and one of those heart defects is a single ventricle defect. Single ventricle anatomy occurs when one of the 2 pumping chambers in the heart, which is called ventricles, isn't large enough or strong enough to work correctly. In most cases, the chamber might be missing a valve. There are different types of single ventricles. There is hypoplastic left heart syndrome, pulmonary atresia or intact ventricular septum, and tricuspid atresia. With HLHS, an underdeveloped left side of the heart, that's what it is. This is where the aorta and the left ventricle are too small, and the holes in the artery and septum did not properly mature and close. With the pulmonary atresia or intact ventricular septum, the pulmonary valve does not exist, and the only blood receiving oxygen is the blood that is diverted to the lungs through openings that normally close during development. In tricuspid atresia, there is no tricuspid valve in the heart, so blood cannot flow from the body into the heart in the normal way. The blood is not being properly refilled with oxygen, so it does not complete the normal cycle of body, heart, lungs, heart, body. And a single ventricle is repaired in childhood. These are some of the things that you can expect. Surgery is often necessary in the first week of life to increase or decrease blood flow to the lungs. A procedure called a shunt is done to increase blood flow to the lungs in the first week of life. What this does is it improves the cyanosis, which is that blue color. Some children with tricuspid atresia have too much blood flowing to the lungs, so they may need a different type of surgery called a pulmonary artery banding. This is done to decrease blood flow to the lungs. This is important to protect the lung vessels. A small number of children have just the right amount of blood going to the lungs and don't need an initial operation. Almost all adults with single ventricle have also undergone subsequent operations to create connections between the body veins, which is like the inferior vena cava and the superior vena cava, and the lung, which is the pulmonary arteries. This is usually done in 2 stages. First is the large vein from the upper half of the body. That's the superior vena cava, and that is connected to the lung arteries in a procedure called a bidirectional Glenn operation. Later, the large vein from the lower half of the body, which is the inferior vena cava, as well as the veins from the liver, are connected to the lung arteries in a surgery called a Fontan operation. Sometimes at the time of the Fontan surgery, an opening called a fenestration is purposely left between the oxygen poor and oxygen rich sides of the blood flows. The Fontan operation may eliminate or greatly improve the cyanosis, or that blue coloring. But without a right ventricle that works normally, the heart doesn't work like a normal heart, which has 2 pumps. When it comes to the surgeries of a single ventricle repair, there are problems that your child will have or you will have as you get older. Many patients have survived 3 to 5 decades after single ventricle surgery in childhood. Many of these patients are highly functional with good activity levels. However, some patients with single ventricle defects do have health problems. In the few patients in whom surgery has not been performed, there is cyanosis, which is lower oxygen levels causing blueness, lower energy, and a higher risk of infections such as brain abscess or endocarditis, which is an infection of the heart. These problems shorten the lives of some people. If you've had surgery for a single ventricle defect, you can live a relatively normal life. However, your ability to exercise vigorously is usually reduced. Several basic types of problems are most common in this group of people. These problems may relate to the person's age at that time of the operation and the type of surgery done. Potential problems include rhythm problems, generally a fast heart rate, which is tachycardia, or a supraventricular tachycardia, atrial flutter, or a slow heart rate. Fluid retention, particularly in the abdomen and lower extremities. Some adults may develop varicose veins after the operation. Greater risk of weakening and failing heart muscle when there's only one ventricle, and blood clots inside the heart that may require anticoagulation therapy. Ongoing care for single ventricle defects are among the most complex congenital heart problems. And so with this defect, you'll need regular checkups by cardiologists with expertise in adult congenital heart disease, as well as ongoing care of adult congenital heart disease if you're undergoing any type of non-heart surgery or invasive procedure. Many people with single ventricle defects require daily or multiple medications. This care is best given by a cardiologist who's very familiar with the anatomical complexities and complications, that these patients have. This requires the expertise of a cardiologist trained in congenital heart disease. You will need at least yearly checkups to monitor your health. This may mean that you may require such tests as an electrocardiogram or ECG, echocardiogram, which is ultrasounds of the heart, including a transogram, echocardiograms. I've probably said that wrong and butchered it. Cardiac catheterization, a Holter, and arrhythmia event monitoring, and exercise stress testing. Activity restrictions: you may need to limit your activity, particularly competitive sports. If you have decreased heart function or rhythm disturbances, you may need to limit your activity more. Your cardiologist will help you determine if you must limit your activities. Endocarditis prevention. Antibiotics to prevent endocarditis are needed before certain dental procedures. And then, you need more surgery. Most single ventricle surgeries are performed in the first 2 to 4 years of life and don't require more surgery. If you have any of the complications noted above, you may need to have prior surgical procedures revised. Additional interventions may include closing holes, pacemakers, or repair or replacement of leaky valves. In rare cases, a heart transplant may be considered. Your doctor will explain these possibilities because each single ventricle has unique features.